Many men do come to me with testis pain, or the pain in the testis, or the pain in the balls, or the pain in the scrotum. So what are the probable causes? So there are so many causes, of course. So one is that there could be something called varicocele, which is basically abnormality in the valves in the blood vessels in the scrotum, leading to dilatation of the blood vessels causing pain. So one is varicocele. Second could be Wallerian degeneration of the spermatic cord. It's basically a type of degeneration of the nerves which can give to constant bothersome pain. And number 3 is probably, especially in the young men or in young kids in the age group between 10 to 25 to 30 years. So this age group, there could be something called as an intermittent testicular torsion, wherein the testis inside, instead of it being fixed at one axis, it starts rotating on its own, which is called intermittent torsion, and because of which the person may get pain. So that when the testis rotates, it leads to pain, and then again it derotates on its own, then the patient may get pain relief. So this is called intermittent torsion. And also there is a small appendage on the testis, like you know about the appendix in the abdomen. Similarly, a small vestigial organ, which means there is no function of the tiny part, it is situated above the testis. It's called appendage of the or appendix of the testis, that sometimes may undergo torsion, that is rotation on its own axis, and it can lead to pain. And there's something called cremasteric spasms. So cremaster is a muscle, it's a thin layer of muscle which is covering the scrotum, which is in the scrotal wall, which occasionally may undergo spasms because of which a person may get pain. Like how you get a muscle cramps in the leg, similarly this cremasteric muscle cramps can lead to testicular pain. And of course infections, any infection of the testis or epididymis can lead to testis pain. And of course, because the testis, there is a connection from the testis to the urinary tract, so any infection of the urinary tract also can lead to pain in the testis. Sometimes even lower urinary tract stones also can cause radiating pain to the testis. So these are all the most common type of causes for the testis pain. Of course, testicular cancer also can cause pain, but that is very rare, and usually you will feel some abnormal hard swelling when we are suspecting any testicular cancer. So again, the treatment depends on the cause. If it's an infection, usually it subsides with antibiotics. If it's a nerve related issue, it may require some medications which improves the nerves. And if it is a stone related issue, we need to give medicines for the stones to pass out spontaneously. And again, if it's due to spasms, we need to give medicines to relax the particular muscle. And if it's an intermittent torsion, which may require orchiopexy, it's a surgical procedure where we fix the testis in one position so that it doesn't rotate on its own frequently. And in case of degeneration of the nerves, Wallerian degeneration of the nerves, we sometimes do offer microscopic denervation of the spermatic cord. So these are the various options. Of course, clinical examination, and we need to do few diagnostic scans to identify these conditions, and most men quite do well after a complete evaluation is done and then after undergoing successful treatments.